Just imagine sitting on the sofa. You are wrapped in a blanket, shivering with a fever, throat burning, and wondering if it's just a flu or something worse. Instead of Googling your symptoms, you open an app. It asks you a few questions, and within seconds, it gives you a list of possible diagnoses, along with advice on whether you need to see a doctor immediately or not. Sounds like a science fiction, right? But this is happening today. Artificial intelligence is already diagnosing illnesses, scanning skin, and reading heart rhythms, and even supporting mental health right from your phone. So here is the questions no one can ignore anymore. Will we still need doctors? In this video, I will show you 5 real ways patients are using AI to take control of their health without even stepping into a clinic. But stay with me until the end because I will explain why doctors are not going anywhere. If you haven't met yet, my name is Beshoy. I'm a surgeon, passionate about surgery and fascinated by medical innovation. In this channel, I will bring you the latest breakthroughs in medicine, from AI and robotics to real-world case stories and surgical insights. So if you are curious about where the healthcare is heading, you are in the right place. So let's get started. Start with the basics. You feel sick, fever, headache, sore throat. You open an app like Ada Health or K Health. You enter your symptoms in a plain language. The AI compares what you have just typed to a massive medical database, thousands of conditions, symptoms, and clinical guidelines, and will give you a provisional diagnosis. Ada, for example, has been tested against real general practitioners, and in some studies it matched or even beat some doctors in some clinical scenarios. K-Health use millions of real patients' records to suggest what your doctor might say even before you book an appointment. But what if the problem is not inside your body? What if it is something that you can actually see? Let's talk about your skin, because yes, even rashes and moles are getting the AI treatment. Now, what if you notice a strange mole or a rash that won't go away? With an AI apps like SkinVision and AIinMedicine, you just take a picture. The app compares it to a massive database of skin conditions and flags any cancer risk. SkinVision has shown 95% sensitivity for detecting dangerous lesions like melanoma. That's a clinical level. AIinMedicine, backed by visual text and Mayo Clinic, helps with rashes, eczema, infections, things we often misjudge or ignore. Now, let's go deeper, literally, because AI is not just diagnosing what's on the surface, it is watching what is going inside your chest. Let's talk about your heart. Condition like atrial fibrillation can be a silent killer. Going unnoticed can cause a stroke or heart failure. That's where KardiaMobile comes in. This pocket-sized device records medical-grade ECG in just 30 seconds and use AI analyzing system to analyze your heart rhythm instantly. It checks for dangerous irregularity like atrial fibrillations, bradycardia, tachycardia, and flags any patterns that need medical attention. It is FDA cleared, widely used by cardiologists, and in some clinical studies, it shows to detect atrial fibrillation with accuracy more than 95%. Of course, not every condition strikes suddenly. Some follow you for life, like diabetes, high blood pressure, and obesity. And here too, AI is changing the game. Managing chronic disease used to mean constant appointments and spreadsheets. Let's start by mySugr, an app designed specifically for patients with diabetes. It connects with your glucometer, logs your blood sugar levels, meals, insulin doses, and even your mood. Then by the help of AI, it analyzes all this data to find the patterns. What's causing the spike? What helps you to stay stable? It gives you a personalized feedback and gentle reminders. So you are not just tracking data, you are learning from it. Now, what if you are dealing with weight, prediabetes, or high blood pressure? Here comes to Lark. Lark uses a conversational AI tool. It literally chats with yourself like a 24-hour health coach. It tracks your sleep, diet, activity, and heart rate. They respond with customized tips. For example, drink water before your next meal, try a short walk after dinner, or looks like your sleep was off, here is how to restart. Lark doesn't replace a doctor, but it fills the gap between visits, helping you stay accountable and stay constant. But health isn't just physical, is it? More and more people are turning to AI, not just for the body, but for the mind. Let's look at how AI is being used to support mental health. Wobot and Chopper are AI therapy bots based on cognitive behavioral therapy. They are trained to respond to anxiety, panic, or depression thoughts in real time. In a study from Stanford, Wobot users showed significant drops in depression symptoms in just 2 weeks. These bots don't replace therapists, but when you need support now, they are a lifeline. So we have seen the power of AI across the board, from infection to heart rate, from long-term illnesses to mental health. It is fast, it is smart, and it is getting better day on day. But here is the part that we can't forget. It is still a tool, not a replacement. AI can give you insight, but it can't hold your hand on the operating room. It doesn't listen between the lines of what you are not saying. It doesn't care, but doctors do. So while AI might be the smartest tool we have ever built, it still needs the heart, judgment, and compassion of a real doctor to complete the picture. Not man or machine, but man with machine. That's the future of healthcare, and it's already here. Thank you for watching. If you want more deep dive on AI, surgery, and the future of medicine, subscribe, hit the bell, and stay sharp.